Probably the most common biologic procedure that we do is platelet injections, called platelet-rich plasma. So platelets are full of growth factors, healing factors, cell signaling factors. And so, once you put that back into an injured tissue, it's really setting off this big signal that says, hey, we have to come in here. We've got to heal this area that's not, undergoing the healing that it needs to. So it kind of stimulates that body to come in there and heal that damaged tissue. Essentially, we draw blood, just like a normal blood draw most people have had in the past. It spins down in a centrifuge, and so that takes about 25 minutes or so. Once that's spun down, again, we usually do it under ultrasound guidance, so bring them into my procedure room where we have ultrasound. We can visualize the site of injury that we want to inject. Usually we do a little local numbing to that area, and then under ultrasound, we inject it right back into that injured tissue. A lot of times, if they need to, if it's soft tissue, we brace them for a short period of time, and then usually get them started in physical therapy after a couple weeks, get them going, and give them a good chance to recover.